Hi, everyone. Yes, I am back, Annette. Um, if this is our first time meeting, well, you're gorgeous. Oh, not you, me. Okay, no, seriously. I know that we are all bored because of this quarantine, and I don't know how long it's going to last, but I think today is the 27th Friday. And I just have one vocal point that I'm going to stick with because I don't know. You see people just, where do I look? I don't know. So I'm just going to have a focal point. Um, so as we're quarantined or locked up or, you know, just captured in this little capsule. Um, I want you to know how I would deal with something like this, or how I am dealing with something like this. Now, something like this, given to me about 5 or 10 years ago, I would be a wreck. I would be, because I have bipolar, blah, blah, anxiety, blah, blah, panic attacks. Okay. So here's what I do to counteract that. One, the best no, I'm going to save the best one for last. I'm going to save the best one for last. One is slow your breathing, obviously. These are so generic. Slow your breathing. This is what I do. This is how I do it. I go 1, 2, 3, 4. 1, 2, 3, 4. And when I exhale out, I push all of the air I have. And I think the bad, nervous, stupid things, I imagine like blowing them all out of my system. Okay, so let's try it. And do that a few times. Only do that one deep breath, like once every other or once every 3 times, because you don't want to pass out. But that slows my heart rate down. Like once I take a deep breath, like don't take a lot of short breaths, take deep breaths and just think good thoughts. Or if you want to be demonic like me, I'm like, thoughts be gone. Okay, not a good look, not a good look. But sometimes I get pretty fierce with it. When I really have panic, I get angry. So, well, the first stages of panic for me are not only do I feel that, but I also feel angry that I'm having it. So then you just like tense up and you're just like, best thing not to do that. Don't do it. Um, I also remember when I had horrible panic attacks. After my son was born, probably during that first year, I had several cases where I would sit underneath a blanket and panic and panic and panic and panic and panic until I seriously thought I was going to die. And my doctor, this was when I first started dealing with it. My doctor obviously gave me an anti anxiety pill. I think it was Ativan at the time. And I felt sick all the time because your adrenaline makes your stomach hurt, makes your tukey hurt. Okay, not your tukey, your butt. Okay. um, and you feel so acidy that you end up going diarrhea and throwing up a lot if you're severe enough. So she gave me the Ativan and I tried that. And all I did was throw it up because I was like, oh my gosh, because I didn't take any medicine at that time, nothing. So anything made me sick. And my doctor also told me, okay, what you're going to do is exercise and like just move your body. And I'm like, you really think you're going to get me to exercise when I'm having a freaking panic attack? I don't think so. So that didn't work for me at that time. But I do remember this one time we were out to dinner with my in laws at the time because I'm divorced now. Man, Ellie, I see you. Okay. First time we went out to dinner, and it was this really, really nice upscale kind of place. And I started having a panic attack. It was all the stimulation, that causes panic attack too, not just being stuck. So what I did is, okay, they said go to to exercising. So I went into the bathroom stall and I was like, you will not get me. Okay, I know. Again, not attractive. But that's what I would do. I would just keep doing that. And actually, it did kind of work because it was taking the adrenaline and putting it towards those muscles because all that adrenaline and the anxiety needs some place to go. Like when you give a speech, it goes that way. When you have a panic attack and it's chemical, or if it's chemical, you're kind of screwed. No, you're not screwed. You have to just learn other ways to deal with it, but it needs to find its way out. And so back to how to deal with it. So exercise, the breaths, and my favorite that works the best for me is, it's called tipping. Not like tipping the cow over at some poor farmer's yard. Okay, yeah, the younger ones, you're not going to get that. Totally not going to get that. Anyway, it's called tipping. So what you do is you, when you feel like you're in a really intense moment and you just can't like stop yourself from thinking, and I put the cold water on in my bathtub. And I stick the colder the better, really. I stick my head underneath there and it feels like heaven. I'm not joking you. It feels like heaven. Because when you're having a panic attack, your head's kind of like on fire. Plus, it's like a shock to your system. It's kind of like shock therapy, I guess. It kind of shocks your system to think about something else. So that's kind of my go-to one when I absolutely can't deal with it. Another thing is to write, or color, or you have to think about what you're going to do that's going to take that anxiety and put it out. Do not think about how closed in the walls are. Do not think about being buried alive. Try to avoid those feelings and just meditate. Meditation, that is another one I do a lot. I meditate. Yahoo, my God. YouTube has a ton of meditation stuff. I use the meditations that have Bible verses because I'm, I don't say religious, spiritual. And I also do the ones that are, there's one that goes, and it's from the monks. And when they go, and it goes on for hours, that centers me for some reason. And I do believe in tones reaching each chakra and how to, read up on it. It's fantastic. The best read that I can give you is Anatomy of the Spirit. It's by Carolyn Myss, Myss. She is amazing. She's a clinical doctor. Plus, she is, I don't know if you'd call her a medium, but sensitive maybe. And then she tells you how each chakra is attended to each part of your body. So when something aches, you have to figure out what chakra it is, and then also how to counteract that or how to fix it or treat it. So, okay, so I gave you my best advice, and I'm going to leave it at that. I hope and pray you are following the rules and staying indoors. I want to go see my mom so bad because she's kind of up there in age and sick. But I can't unless she has an emergency. I'm not going to go over there. I'm not going to go to my son's house. He's not going to come here. So I'm hoping maybe like a month, maybe 2 more months of this to be realistic. So we'll see what's going on. All right, guys. Hope this was helpful. I had fun. And if this is our first date, well, here's our first kiss.